crushed her shoulder after a car accident 16 years ago. She has had 18 operations for the last 16 years. And she had a constant pain, visual analog scale of 5, constant pain, heavily medicated. She tried everything. She'd been to all kinds of treatments. Everything made her worse. The structures in the shoulder was probably healed. So it was more about the brain having fear of movement, producing this pain. And I asked her to cross off the shoulder on the persons she saw in the magazine. And when she was crossing off the left shoulder, which was her injured shoulder, she had slower movement and it didn't go as fast, and she actually started to feel pain just by crossing off the left shoulder. And we also had her in a mirror where she was lifting her right arm, and it was actually mirroring, so looking like she was lifting her left arm, her injured arm. And when she came back a couple of weeks later, she had actually no pain at all, which was quite